If topics like this interest you, please see our PRF versus polynucleotide video. That's salmon sperm. And like and subscribe below so that you're the first one to know when our new videos drop. Watch till the end where we will answer our most frequently asked questions. Skin boosters. You've seen the term everywhere. Glass skin, glow injection, hydration boosters. And I promise you, half the people posting about them couldn't tell you what's actually in the syringe. If this topic interests you, check out my PRF versus polynucleotide salmon sperm video. Hi, I'm Suzy. I'm a physician assistant. I'm trained in neurosurgery before aesthetics. And today, I'm going to talk to you about what skin boosters are and what they actually do and what they don't do. This is part that matters the most, why they are not a replacement for filler, even though half the internet is treating them like one. But what are skin boosters? Here is what skin boosters actually do in plain terms. Skin boosters are a series of micro injections of a very lightweight, unmodified, or lightly cross-linked hyaluronic acid, placed just under the skin, not to add any volume, but to improve hydration, elasticity, and overall skin quality. The hyaluronic acid used in skin boosters is engineered completely different than what we use as a filler. The hyaluronic acid in fillers is highly crossly linked, specifically to hold shape and add structure. That's how it's able to lift the cheeks or fill in the lips or sculpt the jaw. Skin booster hyaluronic acid is thin, spreads evenly throughout the tissue, and its whole job is to bind to water and stimulate the skin's own hydration and collagen response over time. It is injected in a grid-like pattern across the treatment area, usually full face, neck, décolleté, or the hands. We're using tiny needles or a micro catheter rather than a targeted specific fold or a hollow in the way that filler is used. Skin boosters versus fillers, are they the same? I get this question asked constantly, so let's be real clear. Skin boosters versus fillers are not the same thing and they are not interchangeable. Filler adds volume, structure. It can lift, contour, and fill. Skin boosters do not add volume at all. Their entire purpose is improving the quality of the skin itself, hydration, texture, and glow. Filler is placed in specific depths and locations to create shape under the cheekbone, along the jawline, and the lip. Think of skin boosters. They are spread evenly across the area in like a grid-like pattern. The goal is uniform skin improvement, not sculpting a specific area. Filler will give you a visible change in your contour of your skin and of your shape of your face. Skin boosters give you a change in how your skin overall looks and behaves. Smoother, more hydrated, more reflective of the light. Patients often describe it as their skin is just looking healthier, not different in shape. Filler can last anywhere from several months to over a year depending on the product and the area. Skin boosters typically need a series and sessions initially, then maintenance every few months because the hyaluronic acid used is designed to metabolize faster. That's intentional. It's built for a hydration effect, not longevity. So who actually needs skin boosters? Here's where I want to be real honest with you, because this is where the marketing gets ahead of medicine. Skin boosters are excellent for patients whose skin quality is actually the main concern. Dehydration, dullness, fine crepey texture, early loss of elasticity, where volume was never the issue. I see this a lot in patients in their late 20s through 40s who don't need or want filler yet, but whose skin has lost that bounce, that glow. Skin boosters are also fantastic when you layer them with other regenerative treatments. I'll often combine them with skin boosters with PRF or use them as maintenance between treatments of polynucleotide sessions. That's because they're addressing hydration while other treatments are addressing deeper collagen signaling. What skin boosters will not do is fix volume loss, deep, static wrinkles, or structural changes from aging. If you're seeing hollowness under the eyes, loss of cheek volume, skin booster alone is not going to give you what you're actually looking for. That needs filler or PRF, not hydration. What does treatment and recovery actually look like? Practically speaking, a skin booster session takes about 30 to 45 minutes depending on the area. Because it's like a grid of tiny little injection rather than a few targeted points, you will likely see some small bumps immediately, which is completely normal and typically resolve in the next 24 to 48 hours as the product disperses and integrates with your tissue. Mild bruising is possible, same with any injection, but downtime is generally minimal. Most patients are comfortable being seen the next day. Results will build gradually, and most protocols involve 2 to 3 initial sessions, spaced about 3 to 4 weeks apart, followed by maintenance sessions every 3 to 6 months, depending on your skin and lifestyle. Are skin boosters safe? Yes, yes, they are. Hyaluronic acid-based skin boosters have a very strong safety profile. Hyaluronic acid is naturally already occurring in your body, so having an allergic reaction is extremely rare. That being said, this still needs to be done by a trained medical provider who understands facial anatomy and proper injection depth, because even a low-risk treatment carries real risk in untrained hands. So I wouldn't book based on price alone. Food for thought. Skin boosters are not a filler replacement, not a volumizer, and they're not going to fix hollow or deep structural aging. What they are is the best tools we have for genuinely improving your skin quality and hydration from the inside out. If you're not sure whether your skin needs a booster, a filler, PRF, or some combination, that's exactly what a consultation is for. Link is in the description to book with me here, Suzy, at Elcin Aesthetics on the Upper East Side of Manhattan. A 30-minute consultation can change everything. If this has cleared things up, like and subscribe. I've got full regenerative aesthetic series coming. No hype, just what's actually backed by science. See you in the next one. Skin boosters are micro injections of lightweight hyaluronic acid placed evenly across the skin to help improve hydration, elasticity, and texture. Unlike filler, they don't add volume and they don't change facial contour. No, filler is densely cross-linked hyaluronic acid designed to add volume, structure, in specific areas. Skin boosters are thinner forms of hyaluronic acid. They spread across evenly on a broad area to help improve skin quality, not shape. Most patients will need a series of 2 to 3 sessions spaced about 3 to 4 weeks apart, followed by maintenance treatments every 3 to 6 months. Since the hyaluronic acid used is very thin, it's metabolized faster than filler. Most patients will describe a mild discomfort similar to other injectable treatments. Small bumps are normal immediately after the treatment, but they resolve in 24 to 48 hours. No, skin boosters cannot address volume loss, hollowing, or deep structural changes from aging. These concerns typically require filler or PRF. These are not just hydration-focused treatments. Yes, skin boosters are often layered with PRF or polynucleotides, salmon sperm, treatments as part of a broader range of regenerative skincare protocols addressing hydration along with deeper collagen stimulation.